This statement is heavy and weighty, Honorable Speaker. Honorable Speaker, about 2-3 weeks ago, community health promoters from Marsabit sent me a letter. The letter says they have not been paid for the last 7 months. Honorable Speaker, as you are aware, the government is paying $2,500 per person, and the county government is supposed to also similarly pay another $2,500. The national government has paid the dues, but up to today, for the last 7 months, the community health promoters have not been paid in Marsabit. I know, and you know, and this House knows what these people are going through. Even Kenyans know what they're going through. The kind of work they are doing at the hospitals, the problems they go through. Imagine somebody earning 2,500 shillings. That is your transport. That is your house allowance. That is your food. You pay for food. You pay for water, for all those things. Honorable Speaker, I think the health committee, should visit as many as possible hospitals so that they look at how are these people surviving with a mere 2,500 shillings per month, and they are not even getting that money. Honorable Speaker, the issue raised by Senator Mbua on the issue of patient-to-bed ratio, that is also something very important, and it needs discussion. This House needs to discuss how do we have 2 or 3 patients on a single bed. Honorable Speaker, if you go to some hospitals, people are sleeping on the floor. And we are saying we want to go to Singapore. How do you go to Singapore if you cannot even take care of your patients? You are community health providers. So you've seen, Honorable Speaker, complaints everywhere, most of the hospitals. So finally, Honorable Speaker, the issue raised by Senator Mbua touches on infection prevention. That is very important. If you prevent, the cost of treatment will be cheaper. But if you don't prevent, you end up paying a lot of cost. Finally, Honorable Speaker, the issue of cancer, screening, early detection is the most important thing. Do we have those things in the hospitals? In hospitals, no. So what we need to...
Honorable Senators, we shall resume with the order paper, and I shall rearrange the order paper to go to order number 4. Clerk.
Order number 4, petitions.
Senator Veronica.
Thank you, Honorable Speaker. Honorable Speaker, this is a petition to the Senate on the illegal freezing of salaries and the exclusion of 313 seconded early childhood development education ECDE program officers from statutory pension rights under Cap 189. Mr. Speaker, sir, I take this opportunity to present this petition on behalf of Peter Makarangure, Alice Mudhoninganga, Winfred Waboi K. Karaja, Edith Wairimo Gatimu Kariambori, Agnes Joki Kuria, and other petitioners regarding the illegal freezing of salaries and exclusion of 313 seconded early childhood development education ECDE program officers from statutory pension rights under Cap 189. We, the undersigned citizens of Kenya and seconded ECDE program officers active and retired from the Teacher Service Commission to various county governments, draw the attention of the Senate to the following: that following the devolution of pre-primary education 313 ECD program officers were released by the Teacher Service Commission to county governments with effect from 1st July 2015 as permanent and pensionable officers. That upon the transfer of these officers, the National Treasury and the Integrated Personnel and Payroll Database IPPD Department recategorized their payroll status from pay group AA, being the national non-contributory pension category, to pay group AB, being a local contributory category. 3, that this recategorization was irregular and has had the effect of subjecting the officers to unlawful contributory pension deductions, including deductions to provident fund arrangements such as lab trust in some counties, despite the officers being entitled to non-contributory pension terms under Pension Act Cap 189. That the placement of the officers under pay group AB created a technical barrier that disconnected them from salary reviews applicable to their cadre under the Teacher Service Commission, the Public Service Commission, and the County Public Service Salaries Adjustment and Collective Bargaining Agreement benefits. That, as a result, the affected officers' salaries have effectively remained frozen at 2015 levels, causing them to miss salary increments under the 2017 to 2021 collective bargaining agreements, subsequent salary reviews in 2023, and the 2025 to 2029 increments. Honorable Speaker, that the salary stagnation has in turn depressed the officers' pensionable earnings, thereby exposing both serving and retired officers to reduced pension benefits that do not reflect their lawful entitlement or their years of service. That recognizing this grave error and the irreparable prejudice likely to be suffered by the officers, the National Treasury issued a directive dated 22nd March 2022, reference TNT/PENS/15/4/20, expressly requiring that the officers be restored to their rightful status under the Pension Act, Cap 189. That despite the said directive, the Teacher Service Commission and the IPPD Department have failed to effect the required recategorization, thereby leaving the officers in prolonged administrative limbo for over a decade. That the affected officers now face double exclusion in that they are denied TSC-related salary progression because of the AB coding, while at the same time they are not fully integrated into county or public service payroll structures because they remain substantively officers of the Teacher Service Commission. That retired officers in this category are already suffering prejudice because their pension awards are being computed on outdated and frozen salary scales instead of reconciled salary levels, resulting in unfairly low pension payments. That the officers who have retired and those due for retirement stand to suffer irreparable financial loss unless urgent corrective measures are taken, including restoration of the proper payroll category and reconciliation of their service records, including GP69 cards where applicable. Wherefore, your petitioners pray that the Senate investigates the matter with a view to 1, recommending that the directive of the National Treasury is implemented and that all historical data migrated from the legacy system is corrected to reflect a non-contributory status and to simultaneously update the officer's manual GP69 service records to reflect continuous service with zero service gaps from 1st July 2015 to date. 2, recommending that a comprehensive salary audit and reconciliation for the 313 officers, effective 1st July 2015, be done to include all annual increments and collective bargaining agreements, CBA salary awards 2017 to 2021, 2021 to 2025, and 2025 to 2029 that were missed during the period of suspended status. 3, recommending that the National Treasury releases arrears arising from the corrected salary scales and allowances, house, medical, and leave allowance to all active and retired petitioners. 4, recommending that the revision of pension awards for retired officers in this category be done using their newly reconciled final basic salary as the base for calculating their monthly pension and lump sum gratuity under Cap 189. 5, recommending that any contributory provident fund amounts, LAPTRA / CPF, deducted in error from the petitioner's salaries be stopped and refunded with interest without affecting the officer's non-contributory rights under the Pension Act. And 6, recommending that the 313 seconded ECDE program officers be recognized as having served continuously and without interruption under the Teacher Service Commission from the date of their first appointment, and that any exit or non-claim clause in the 2017 to 2021 or subsequent CBAs shall not apply to them, since their transfer to county governments was an authorized secondment in the public interest and not a voluntary or professional exit from the teaching service. That is the petition from the petitioners, and I beg Senate to consider this an award as requested by the petitioners.
Honorable Senators, pursuant to Standing Order 238-1, I commit the petition to the Standing Committee on Education for consideration. In terms of Standing Order 238-2A, the committee is required in not more than 60 calendar days from the time of reading the prayer to table its reports in the Senate for consideration. The Senate shall thereafter consider the report of the committee. I thank you. We shall rearrange the order paper and defer order number 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, and order number 22. And I'll rearrange the order paper so that we consider order number 25, then followed by order number 24 and order number 23. Clerk, read the order.
Order number 25, the Community Health Promoters Bill, National Assembly Bills number 53 of 2022, second reading.
Majority.
Nenge Mike. Very good. Mr. Speaker, sir, I beg to move that the Community Health Promoters Bill, National Assembly Bill number 53 of 2022, be now read a second time. Mr. Speaker, the Community Health Workers Bill, National Assembly Bill number 53 of 2025. The proposal is to amend the title of the Community Health Promoters Bill. Was published in the Kenya Gazette Supplement number 183 of 2024, dated 10th November 2022. This bill passed the National Assembly on the 2nd of December 2024 and referred to the Senate for consideration. The principal object of this bill is to regulate the practice of community health promoters, that big army called CHPs, which many of us have come to love, and to establish the Community Health Promoters Council. Community health promoters serve as a bridge between communities and health care systems. They are trusted members of their communities, possessing a deep understanding of local cultures, language barriers to health access. This enables them to provide culturally appropriate health education, promote preventive care practices, and facilitate access to essential medical services. Their unique position allows them to build strong relationships with individuals and families, nurturing trust and encouraging active participation in managing own health. CHPs, Mr. Speaker, impact and are of great importance to our society. Their contribution to the health ecosystem in this republic cannot be gainsaid. They increase access to health care, they promote healthy behaviors and cultural practices, discourage communities from engaging in retrogressive cultural practices that injure the health of members of the society, because they are members of that community and they engage and participate in it. By empowering community to take control of their health and connecting them with the necessary resources, CHPs contribute to more equitable and sustainable healthcare systems, ultimately leading to healthier societies. They also reduce burden on hospitals and clinics, providing essential care at the community health level. Even though the first schedule of the Health Act, Cap 241, designates community health services as a level 1 service delivered by community health extension workers, the majority of community health workers, now called CHPs, are volunteers. I think I heard somebody, it was Senator Cherargei, yesterday say that actually this stipend of 5,000 that they are paid is against the law. But I want to believe that this consideration they get is not compensation for the work that they do. It more of, to me, looks like an appreciation more than a salary, because there's no way you can pay anybody a salary of 5,000. But then, this week I was somewhere with some governors, and I was asking them, while we were just discussing about this division of revenue and why. You remember we had requested, Mr. Speaker, that on division of revenue, we take the 2,500 share of the national government and make it part of shareable revenue to counties. Why does national government insist on holding on to 2,500 shillings to CHPs as opposed to sending it direct to counties? And that is something that remains, needs to be discussed. And they were telling me that majority leader, to you, 2,500 shillings is nothing. But we can tell you that these 5,000 shillings means a lot to many of these guys. It is over and above what they earn or what is their daily income. And it helped me appreciate something that I was once told, that as a leader, never lose sight of perspective. That there are many times, Mr. Speaker, that you say things as you see them just as a leader. But a good leader sees things sometimes also from the constituents' perspective and the people that you represent. So while 5,000 may be nothing to a wealthy don from Garissa called Abdul, Mr. Speaker, not you, I'm talking about another Abdul who's my friend. But to the ordinary Abdi, now that you want me to use, deep down in your village, in the place we went, I forget in Masalani, Mr. Speaker, it means a lot. And of course, this is not to make the case that we should not remunerate them better. Actually, this bill, Mr. Speaker, is to set up the structure with which we can appreciate community health promoters, Mr. Speaker. And I know all of them, including those that voted for me in Kericho, as I watched their senator this afternoon on the floor, they're extremely proud and happy because they know that upon the passage of this bill, we will actually duly recognize them, give them certification, Mr. Speaker, and make their pay even better. Mr. Speaker, you know we have just rolled out UHC, and you cannot expect that everything will be perfect from the start. But I know that 3, 4, 5, 6 years from now, Mr. Speaker, when UHC has settled properly, when compensation to public hospitals, including dispensaries deep in the village where Senator Catherine Muma comes from, in my neighborhood, down in Kisumu, small dispensaries, the minute we'll have perfected the system and ensured that they get compensated directly, and that hospital is able to manage its affairs, order medicine, Mr. Speaker, and have some of these promoters even on call, so that if the doctor is away, the community health promoters can help locate the next facility and call for medical help and make the right determination, Mr. Speaker. We will have celebrated these people. Therefore, this is for you, community health promoters, across the Republic of Kenya. And there are so many. There are over 100,000, if I recall. Actually, Mr. Speaker, why I am particularly proud about this bill is that CHPs were launched in Kericho in 2023 during Mashujade. And Kericho will always remain their home because this is where they began their work. I remember them marching during the Mashujade, that particular morning, Mr. Speaker, at Kiprugut Chumo Stadium. And I know, Mr. Speaker, that as we work by the turn of, or the drawing of the curtain of the session of this parliament, if we will have succeeded to conclude on this bill and ensure that CHPs, Mr. Speaker, are properly now compensated, captured in the public health systems properly, Mr. Speaker, given even more training, because while they might not be doctors, Mr. Speaker, they have some basic elementary training on matters, Mr. Speaker, public health, and it will be extremely important to engage and interact with them. Even though, Mr. Speaker, the first schedule of the Health Act, Cap 241, designates community health service as level 1 service delivered by community health extension workers, the majority of community health workers now called CHPs, they are volunteers, who sometimes receive allowances that are often delayed or never paid at all. It's embarrassing, Mr. Speaker, that there are certain counties that delay even these little 5,000 that we are talking about as compensation to these volunteers, Mr. Speaker. Why we are proposing a legal framework is to enhance their recognition and regulation so as to allow them to be entrenched in the government health delivery system, and it establishes the Community Health Promoters Council and the Community Health Promoters Disciplinary Committee to regulate the conduct of CHPs. I have a challenge with that proposal, Mr. Speaker, because much as health is a special and a unique service, we will have to find a way. You know, Senator Maanzo, when county employees misbehave, generally all of them, it is the County Public Service Board that punishes them, the same way it handles their promotion and disciplines them in case of misbehavior. But also remember, one thing we have not been able to successfully do as legislators is to establish a nexus between County Public Service Board and the professional bodies that many of these staffers belong to. If it's accountants, Mr. Speaker, how do you link the County Public Service Board with ISPAC and even recommend sanctions against, say, an accounting officer who participates in fraud? Last week, Mr. Speaker, I was chief guest at the Kenya Institute of Supply Chain Managers Association in Naivasha. And you're interacting with all the supply chain managers from our 47 counties, Mr. Speaker. Your people from Makueni, some of them spoke. There are people from Siaya, across the country, Mr. Speaker. And the thing that we must all agree is that we must create, as Parliament, particularly us as senators, the nexus between regulatory bodies that regulate professional practice, ISPAC for accountants, KISM for those that are in supply chain, KPMDU and Nursing Council, those ones for those that are in the health space. So we will have to locate for these particular CHPs, there are elements that have to be handled. Issues of discipline, issues of transfer, issues of their promotion, the scale at which they enter the workforce, Mr. Speaker. Those needs to be handled by the Public Service Board. But then we will have to set the agreement with the regulating bodies in the health practitioners space, Mr. Speaker, to see where these CHPs will fall under. These committees, Mr. Speaker, will actually find time to look into this and guide us on how we conclude. So under Part 1, Mr. Speaker, which comprises Clause 1, Clause 2, Part 2 comprises Clause 3 to 16, and all so on and so forth. Therefore, this is a very straightforward bill, Mr. Speaker, which I believe members of the Senate must certainly give it the priority that it deserves. Senator Mungatana, you know very well that there are thousands of CHPs deep down in Tana River. If there is a favor that you can do to them, and those that attend to them, my good brother, or those that draw service from them, is to ensure that you motivate them. Set up the regulatory framework like you are proposing in this particular bill, so that when they go to vote next election in Tana River, they have a reason to say, I sent a man to the Senate who represented my interest, and they made sure that I am properly considered. And the same passes for all of us. I am sure colleagues have various thoughts on how they think maybe certain matters need to be handled. I know, for example, one of the challenges that we will experience is how do you transfer them from being this voluntary basis into the cycle of public service, given that they were not necessarily competitively recruited. We normally have a very big challenge with that. Here in Parliament, for example, I know when I served in a Parliamentary Service Commission, there were staffers that we had requested from other government entities, like NYS and the rest, to do various duties here within Parliament. And they had served for long, until one time we said we need to have them part and parcel of the parliamentary staffers. But it became a huge challenge because the constitutional dictates that we all live and work under, Mr. Speaker, require that all public service appointments be competitively recruited. Yet we know that these people provide a specialized service. Therefore, there are certain things that we will have to find a way, a neater way of clearing and sorting all those things. Therefore, Mr. Speaker, it is my utmost hope that members will share their thoughts on how we can shape this space of community health promoters, Mr. Speaker, to ensure that they serve in the village. Some of them actually provide service which maybe doctors will struggle to. They perform certain things which even modern hospitals will struggle with. Don't underestimate the value of traditional medicine and people who have local knowledge on certain localized health challenges, Mr. Speaker. They know, because many of us here that have the distinct privilege of coming from villages, Mr. Speaker, that are serene. You know, I was saying that because I saw a clip the other day of somebody, I think it was a senator of Nairobi, making it appear as if there's anything to be celebrated about coming from the city. To me, if I had the choice, Mr. Speaker, because it's by nature that you choose what you represent, but if I had the choice, I'd pick the village any day over the city, over this clogged up city with all the challenges, many of these things. And I know many of you will do the same. Therefore, I was saying that there are unique challenges, Mr. Speaker, that come with working in the city and ensure in the villages that these CHPs can handle better than even our other health practitioners. Therefore, Mr. Speaker, I want to listen to colleagues, share their thoughts and ideas on this particular topic so that we can progress and move with it and help achieve universal health care. With those many remarks, Mr. Speaker, I beg to move
and request the Senator for Nandi, Senator Samson Cherargei, to second.
Seconder, proceed.
So, Mr. Speaker, sir, it is with distinction and honor that I rise to second this very critical bill. Mr. Speaker, let me, as I second, to begin by saying, and we have agreed that the success or failure of devolution in this country will be based on how we manage health sector. And now that the majority leader, the distinguished Senator of Kericho, and my neighbor, Senator Aaron Cheruiyot Kipkurui, is called Telwa in some other circles in the village, Mr. Speaker, is called Telwa. Telwa. Telwa in some other circles, Mr. Speaker, sir. It's an honor, and I was in that stadium, in Kiprukut Stadium, in Kericho, when we launched the community health promoters, and I felt the pride. Because, Mr. Speaker, you know, even today in Wajir, in Salmalmak location, in Deepwood, in Wajir South, in Wajir County, the elders there called me today and they are complaining for lack of drugs in Wajir County despite receiving 12 billion. Mr. Speaker, we have spent many minutes and hours here discussing about 1 billion expired drugs that is with KEMSA, Mr. Speaker, and mostly are cancer drugs, they are malaria drugs, they are HIV and AIDS drugs. And most of these drugs, Mr. Speaker, are drugs that should assist Kenyans. Mr. Speaker, for us who are village senators, we attend a number of funerals over the weekend, and most of our people are dying because of cancer. When you hear KEMSA is losing 1 billion to expiry of drugs, involving cancer drugs, Mr. Speaker, some of us feel like crying. And I'm disappointed because this is the OAG report which did the report. But, Mr. Speaker, we hope and believe that for the last 15 years, 4 trillion Kenya shillings have gone to our counties. We are yet to see the value of that 4 trillion Kenya shillings, Mr. Speaker. I'm aware the budget has just been read today by the CS of National Treasury, Mr. Speaker, where we are going to give counties 428 billion, an additional 13 billion from 415 billion. We want this money to give value. Mr. Speaker, yesterday we did move the county government's additional allocation bill. And let me begin from there, Mr. Speaker. The community health promoters received 3.2 billion in terms of stipend. I'm happy the majority leader, while moving, Mr. Speaker, has indicated that this is a stipend, Mr. Speaker, because the minimum wage of this country is 18,000. So if the national is paying 2,500 shillings and the counties are paying 2,500, which is normally late because of late exchequer releases, and the ministers of national treasury since 2013 have always violated Article 219 by delaying the disbursement of cash to our counties, Mr. Speaker. This issue of remuneration, we must look at it. I agree this could be stipend. It means a lot. 5,000 means a lot for somebody who wants nothing. But that one should not allow us to violate Article 41 and Labor and Relations Act. I'm happy the majority of the leader, who is the mover of the motion, has indicated that this is just the framework. This is the baseline. This is the foundation where we'll be able to come up with remuneration for our community health promoters, Mr. Speaker, because we don't want to suffer like ECD teachers. Even from Nandi, Mr. Speaker, my ECD teachers are scheduled to go on a strike. Mr. Speaker, we should not subject employees working for counties at the mercy of governors, Mr. Speaker, who don't see the value of those people. Yet you still find ghost workers in a number of counties. You saw Uasin Gishu County has around 765 ghost workers, according to financial year 2024-2025, which are used for political expediency, Mr. Speaker. So in Nandi, for example, Mr. Speaker, under this financial year of 26-25, because I'll be very brief and efficient, Mr. Speaker, Nandi is going to receive 96.60 million towards community health promoters in the county government additional bill as per Article 202 of the Constitution of the Republic of Kenya, Mr. Speaker. So, Mr. Speaker, out of 3.2 billion, 96.6 million will go to Nandi to support. Mr. Speaker, my only request is that let us ensure timely disbursement so that as the national government gives 2,500 shillings, the counties are able also equal to give 2,500 in good time. 5,000, Mr. Speaker, I highly doubt, because I know the dawn
Abdi of Garissa cannot eat 5,000 for lunch. 5,000 is when you go to Serena or Kempinski, Villarosa, and I saw my brother Senator Aldama was in France. I don't know whether 5,000 will be enough for the king of Ma to even have some salad in a very high-end restaurant somewhere in France, Mr. Speaker, or in the streets of Paris, Mr. Speaker, especially after visiting the Eiffel Tower in somewhere in France, Mr. Speaker. So I agree with the majority, and I hope, Majority Leader, when we pass this, we must come up with how we can ensure they are remunerated, because I know Senator Chute, who is my very good friend, also have similar concerns. We appreciate, Mr. Speaker, and I'm happy, because I'll only make 3 points. My second point is I'm happy that these community health promoters, we have been provided for under the second schedule, that their work is community health, Mr. Speaker, psychology, counseling. Mr. Speaker, I want to add, if it is not too much trouble, and request Majority Leader, who was the ear and eyes of the President, to also ensure community health promoters visit some of our schools so that they can be able to provide psychology and counseling to our children who continue, a number of them, to ban schools and school unrest and strikes, Mr. Speaker. It is important, Mr. Speaker, especially women in home who have just passed, it's called, when there is a name that is normally said when a woman has just delivered, they sometimes have depression. I think this is very important on psychology and counseling. Mr. Speaker, on community health, you know, a number of our people suffer because of preventable diseases. Just ensuring that water is well treated, ensuring cleanliness. Mr. Speaker, did you notice when we implemented fully the issue of cleanliness, the issue of wearing masks and sanitization, a number of diseases in Kenya just flew away, Mr. Speaker. Even cough, the issue of sickness because of poor handling of food came to an end. So community health promoters will be, even social work, Mr. Speaker, I am happy, Mr. Speaker, will ensure that social work works. There is the issue of community HIV counseling and testing, which I know with the USID, Donald Trump, and the issue of supply of the anti-HIV drugs has been a problem in this country. But, you know, I feel sad that the 1 billion, that, you know, the other day we were complaining, Mr. Speaker, that there was lack or inefficient supply of HIV and AIDS drugs in the country. But it is very unfortunate that it has expired in KEMSA, that 1 billion worth of drugs, some of them were involved. Even immunization to our children, Mr. Speaker, you have to appreciate, Mr. Speaker, some of us were born at home. And we thank God that we survived, Mr. Speaker, because we used to have those women, the midwife in the village. They dealt with our matters properly. Some of us were even kichwa ngumu, even during our birth. So, Mr. Speaker, you can imagine the midwife had a lot of work, Mr. Speaker, and you find most of our children, and for us village senators, most of our mothers still give birth in the village setup. And there are midwives, even I know in Marsabit is similar. So most of our children are not immunized in the village. So this one will assist. And also say, Mr. Speaker, you can imagine somewhere in Digir, a mother has to travel maybe to Digir town or all the way to Narok town to get immunization. You can imagine the transport, they have to carry the young baby. But if you send the community health promoters to do immunization, Mr. Speaker, it will be easy. I don't know whether it is different in Makueni. For us who represent rural counties, even Siaya, where they distinguish the king of ODM and ODM party leader, agree with me that immunization, we must send the community health promoters. They can even weigh and advise, Mr. Speaker, on nutrition to our mothers, the new mothers, Mr. Speaker. But I know Senator Muma will be in better place to explain such, because having undergone through motherhood, then she understands better. Community development, Mr. Speaker, is very critical. Health education is very critical. Any other relevant training as prescribed by the Cabinet Secretary. So, colleagues, this is what the community health promoters will be all about, Mr. Speaker. The aspect is just to establish the council that will ensure this will be my third and final point, is to assess the qualifications of community health promoters, maintains improvement, and ensure there is professional code. Mr. Speaker, we are aware most of these CHBs will work around our houses. We also have a professional code. We must have discipline, because we don't want people who might not have good habits to go to people's home and maybe steal or misbehave, Mr. Speaker. So I'm happy that this council, that the mover of the motion, Majority Leader, has indicated, will ensure that there is code of profession, because every profession must have a code. There should also be qualification, disciplinary measures, professional code, register and keep record of all, and even the issue of disciplinary, Mr. Speaker. And I'm happy, Majority Leader, that there is collaboration between Kenya Medical Practitioners and Dentists Council, KMPDC, the Center Board of Health and Clinical Officers, KUKO, will also be part, and also Nursing Council of Kenya for standardization and professional that we ensure. And also the advice, Mr. Speaker, I don't know whether the Majority Leader will allow us in the third reading, in clause number 5, to include also the assessment and setting of issue of salaries and remuneration for community health promoters. Mr. Speaker, on the issue of the establishment of council, I know members know you must be a man of integrity and all those issues, so I don't want to be devil, because it is mutatis mutandis in a number of laws that we have. Even the powers of council are the same, the tenure of office, Mr. Speaker. The issue of allowances is set by SRC, which is a norm as advised, Mr. Speaker, and I think it is very important. The issue of registrar will ensure that its records are kept on community health promoters and particulars of the register, Mr. Speaker. On the issue of disciplinary and the issue of courses that will be prescribed, that will be done, Mr. Speaker, as the second schedule by, Mr. Speaker, I'm happy, and allow me to say this, that even in this budget, I have seen a number of constituencies, almost 290 constituencies in our counties, are going to have KMTC, Kenya Medical Training Colleges. I'm happy, Mr. Speaker. Even in Nandi, I think we have 2 or 3 KMTC all over the country. This will allow to ensure that our sons and daughters are trained in the KMTC for these courses, so the approval and in their villages and registration, Mr. Speaker. And I'm happy in this budget that Honorable Mbadi has just read is pro-mwananchi budget, Mr. Speaker. I know it is the highest 4.8 trillion Kenyan shillings. We hope to see KMTC being constructed so that courses are affordable, Mr. Speaker, and appeal to Higher Education Loan Board, now that I've gone 3.7 billion, to ensure our children in KMTC are also getting loans like you, like me and Manzo. We were able to get Higher Education Loan Board when we went to university. Why is it that KMTC students should get loans so that we can ensure? We also want to see, even in teachers training, Mr. Speaker, are you aware our students in teachers training are not getting loan than like the university? I think that is violation of Article 27 on discrimination, Mr. Speaker. So, Mr. Speaker, with those very, very many remarks, Mr. Speaker, yes, Mr. Speaker, I think Senator Chute, I don't know whether he's holding brief for the Majority Leader, but also to ensure that we are protected in terms of those KMTC. If they read, Mr. Speaker, our girls also will get opportunity to study, because there is what we call female power. And we want the female power to be felt in the boardroom, in the villages, and of course in the bedrooms as usual. Mr. Speaker, with those many, many remarks, let me end there and second and say this is a very important bill that we must support as a House. This is a bill that we must support as a House. In fact, this is the only bill, Majority Leader, that I am proud of National Assembly. On others, they are getting 99.9%. But on this bill, I agree for the sake of community health promoters, which is 100,000 plus across our country. And we thank the President for that wisdom, for that, Mr. Speaker. Our President is always ensuring that there is development. And I think this was his idea, Mr. Speaker, that we have CHPs in our counties. Mr. Speaker, with those many remarks, I would also want to listen to colleagues, including the King of Ma, Senator Ledamo Lekina, Mr. Speaker, to speak some wisdom. I beg to second and yield the mic. I thank you, Mr. Speaker, sir.
Honorable Senators, I propose the question that the Community Health Promoters Bill, National Assembly Bill number 53 of 2022, be now read a second time. Honorable Senators, I shall allow members to debate, and just to get concurrence from the House, if we should put a limit to the time. Is 5 minutes okay for each? 5 minutes, very well. I'll start with the Majority Leader. Senator Oburu needs to contribute. He's the first on the list.
Give him 10 minutes.
Senator Oburu.
Wisdom. Power.
Thank you. Mr. Speaker, sir,
Yes.
thank you very much for the opportunity to contribute to this important bill. Mr. Speaker, some of us who are born in the rural areas and stayed in the rural areas know the importance of these primary health care workers. The primary health workers, Mr. Speaker, sir, are the ones who take care of the ordinary person when they get any disease which is inexplicable, which they cannot use traditional medicine to treat. They fall in the hands of these community health promoters. And the concept of community health workers came from the Bamako concept, when medics sat and agreed that there need to be a formalization of community health workers who take care of primary diseases at the primary level, at that low level, Mr. Speaker, sir. And this concept was meant to recruit and train some villagers within the community on basic health care and also on basic medicines which they could use, and give them free kits which they would then dispense of in the village and charge some minimal fee, so that money becomes a revolving fund and they keep on buying the medicine for their kit and sustain themselves. So there was no intention of that Bamako concept to pay anything. But later the government thought of giving some stipend, some small supplement to that concept, and people were being paid 2,500. But then it increased to 5,000 when the national government came in and now supplemented counties who were paying something like 2,500. And Mr. Speaker, sir, this is now an improvement, even a further improvement
Senator
on
Oburu.
that concept, Mr. Speaker.
Senator Oburu, there is no speaker, sir, here.
There's no?
There is Madam Speaker. There is no speaker,
Madam
sir, on the
Speaker,
chair right now.
Yes, there's a change. Oh, Madam, I'm so sorry. I'm so sorry. Madam, I'm so sorry. I did not notice
Apology accepted.
The change, and I'm deeply apologetic to that. So, Madam Speaker, this concept has now further been improved, and it is now being formalized. These primary health workers, which are the community, at the community level, are now going to be formally employed, and they are going to have some little qualification to take care of our mothers and our fathers and our children at that primary level. And Madam Speaker, this is a very, very great feat, and it is a great achievement for our country. It is a big step forward, and I hope that our people will embrace it and now improve provision of services to our people at that level. Madam Speaker, some of us who grew up in the village, we were recognizing even we had traditional birth attendants, those who are giving mothers, who are attending to mothers who are giving birth right in the village. And they knew what to do.
I can see your time is up, and though I appreciate that those who are raised in the village tend to have a very deep sense of pride in their way of life, their way of food, their way of culture, I will give you 1 minute because I also grew up in the village to hear that story.
So, Madam Speaker, we used to recognize even the clinical officers or just dressers, people who are dressing wounds in the village as doctors. We used to call them doctors. But Madam Speaker, now we are having people who have at least some primary training in healthcare, and they are going to to care for our mothers and children at that primary level. And this is a good improvement, and I support it, Madam Speaker. And with those many or few words, I beg to support. Thank you, Madam Speaker.
Thank you, Senator Oburu. Aka Youth Leader, Senator Wakoli, you're next.
Thank you. Asante sana Speaker kwa nafasi hii. Vile vile ningependa, kwa sababu majira ya asubuhi kiongozi wangu wa chama katika wadi alikuwa nakutana ama alikuwa na kikao na madaktari mashinani hawa, Mheshimiwa Speaker, katika wadi ya Tuti Marakaru leo asubuhi. Na niliwahakikishia kwamba katika jumba la Senate sitasinzia, sitalala, na nitazungumza kwa niaba yao kuwatetea. Na nina furaha gaya mpito jioni ya leo kuambia Wakenya kwamba serikali ya Kenya Kwanza, ambayo mimi ni kiranja wa wengi katika jumba hili la Senate, katika bajeti imewekea bilioni 3.23 kwa hawa madaktari mashinani, na hizi ni fedha ambazo tuna uhakika nazo. Na ni kuambia kwamba tutashinikiza magavana wanapopitisha bajeti zao muda mchache kutoka sasa, wahakikishe pia wao wanatangaza wazi fedha za madaktari mashinani hawa, kwa sababu katika kaunti yangu, Mheshimiwa Speaker, miezi 5 sasa hawajalipwa pesa zao. Na huku Mheshimiwa Rais akienda vijijini, wao ndio wa kwanza kunyosha vidole viwili, Mheshimiwa Speaker, kumtukuza Mheshimiwa Rais, lakini madaktari mashinani wanaumia. Mheshimiwa Speaker, kule Bungoma madaktari mashinani ni 3590, na wao wanahudumia mmoja wao kila boma 100. Hii inaashiria kwamba wao pia wana uwezo wa kueneza amani, mustakabali mwema katika jamii. Hapa katika bajeti hii ya bilioni 3.23,
Bungoma inaenda kupata milioni 107 na 1,400, Mheshimiwa Speaker. Hizi ni fedha ambazo madaktari mashinani wa Bungoma lazima ujivunie kwamba sisi kama serikali ama viongozi wa wengi na viongozi katika Kenya Kwanza tumeweka kwenye bajeti pesa zenu, na hizi pesa zitakuja katika account zenu bila kupitia wale ambao tunasema mabroka katika lugha asili kule mashinani. Sasa mimi, Mheshimiwa Speaker, ni kushukuru serikali, kushukuru daktari mashinani katika kazi nzuri ambayo wanafanya kutibu watu, kuwapa mawaidha, kuhakikisha kwamba wanawapa matumaini wagonjwa, na vile vile kuhakikisha kwamba katika mashinani afya inaendelea kudumu. Changamoto tu, na ningependa kurudia, magavana wahakikishe bajeti wanazopitisha zao ziwe na fedha za madaktari hawa. Isiwe kwamba sisi kama jumba la Senate na serikali ya Nairobi zinalipa pesa, lakini magavana ni kuwayumbisha tu, kuwachezea karata, kuwatishatisha wanapoitisha mshahara, kuambia kwamba tutawafuga. Na kuungana na hoja ya Mheshimiwa Aaron Cheriot kwamba tunataka kusonga mbele, wawe pia na stakabadhi ambazo watakuwa wanajua wameandikwa kazi na mshahara ni pesa fulani, na kama kuna shida kati yao na mwajiri watatumia mbinu zipi kutatua. Isiwe tu kwamba wanafanya kazi kwa huruma ya mtu fulani kwa sababu yeye ni gavana.